Let's discuss the management of BPPV, benign paroxysmal positional vertigo. It's really important for general practitioners to be able to manage BPPV well in the general practice because loads of patients present with dizziness and vertigo, and GP is expected to be competent enough to deal with such a situation because it can avoid unnecessary patient anxiety and unnecessary referral to the secondary care. So how do we manage a condition when a patient has come to us? So once you on the basis of your history and examination, you think that this patient has got BPPV, explain the situation to the patient that it's a condition of the inner ear which usually deals with balance. It's a benign condition in which a small calcium deposit, it moves inside the waters of your inner ear and causes this balance problem and makes you feel a bit dizzy or causes this vertigo. Explain that it's a benign condition, not a serious one, usually takes a few weeks to a few months to settle. How do we manage it in the general practice? Explain that there is no medication to treat this condition. We can, in fact, do a maneuver called Apple's maneuver here in the practice, which in 90% of the cases helps resolve the symptom. If the symptoms does not get better after doing Apple's maneuver, you can still advise the patient to do some exercises at home. Give them leaflets for branded of exercises which they can perform at home. Secondly, it's very, very important that a GP should be able to give some important advices. First of all, not to drive. Explain to your patient that, Mr. X, it's really important for you not to drive for a few days till you get better, since this dizziness can be a risk factor for yourself and for others on the road because you can meet an accident. Number two, ask the patient not to move his head suddenly or quickly from side to side to avoid having these symptoms every now and then. And if she is or he is quite old, they can use some walking aid or a stick to support themselves to prevent having a fall with this dizziness. Explain to your patients as a red flag, if they develop any red flags, like, for example, weakness in a part of the body, any blurring of vision, any headaches, or any other new concerning symptoms at all, they can always get back to you. If the symptoms do not resolve in 4 to 6 weeks' time, the patients can be referred to secondary care to be seen by the ENT specialist to rule out any other causes causing this vertigo or dizziness for this patient.